Welcome back to Menopause Mastery. So, today I talked to Dr. Melissa Batchelor. She is a nurse and nurse practitioner with nearly 30 years of experience, specifically caring for older individuals and their families. She is geriatric certified, and she's also a host of a weekly podcast called This is Getting Old, Moving Towards an Age-Friendly World, where she talks about issues related to aging and Alzheimer's disease. So we had such a great conversation. So first and foremost, we went through some of the different forms of dementia and Alzheimer's and the common causes of those diseases. And so we went into a little bit of depth. So if this is one of those things that you are, worried about, I would say it's definitely the clinical concern that most women share with me in the room is I am terrified of having dementia or Alzheimer's. And so we go into a little bit of detail about how to identify those things because it is a disease that actually starts in midlife. We just happen to see the symptoms often later in life. And then we have a really good discussion about the sandwich generation, which is us, and the caring for ailing parents. And how do you sort of navigate that? What things do you need to think of, and what ways do you need to sort of prepare yourself in order to be able to do that and really take care of your loved one in a meaningful way. And so tune into this week's episode while we talk about dementia, Alzheimer's, and moving towards an age-friendly world. All right, Melissa. So this is going to be a great conversation because I think I know from being in clinical practice for a very long time that almost every woman will say to me, I'm worried about dementia and Alzheimer's. And I think it's one of those things that people are fearful of, but they don't understand enough about it. And we're going to talk about kind of many sides of it. So, what pieces are at play in dementia and Alzheimer's? How does it get going? What's happening? And then also, another really big aspect of women's lives, which is spend caregiving caregiving as somebody who's immersed in caregiving. And it's huge and it's super huge. So I'm so excited to talk to you because this is obviously your world. So how did you, I know you're a nurse practitioner, obviously from my intro, but how did you get into healthy aging and looking at Alzheimer's, dementia, and the aging environment?
Well, when I was in nursing school, I was one of the students that said, I don't care where I work, but I'm never going to work with older adults and I'm never going to work in a nursing home. But that's where I got my first job. And so I actually have never worked in a hospital, and kind of got into working in the nursing home environment and didn't exactly like what I saw, but I knew that if I left it, I could never make it better. And some of my favorite people to take care of were people with very advanced Alzheimer's disease, as well as their families. Because if you have somebody that's 80 in the nursing home, the chances that their child is like in their 60s, it's pretty common. When you have a 102-year-old and their daughter's 80, then you get the grandchildren in their 60s and 70s. So it's just a lot of older adults. And I just love that population. And I felt like there weren't enough providers in this country with expertise. And so that's really kind of how I got into it. And then have stayed in it as nurse practitioner, and now as an academic. My program of research is in Alzheimer's disease because I also love to eat. So I was like, if you have to have a PhD and study something forever, I love to eat, love to take care of older adults with Alzheimer's disease. And so that is kind of how I ended up here.
So tell me, so I think it's kind of shocking when we think about it today, just the sheer numbers of people going into assisted living and dementia. I mean, in one aspect, we, have these extraordinary extension of life. Just in 1900, our lifespan was just a few years after menopause. But now you're looking at 30, 35 years post menopause, living into our 80s and 90s and above. And and I think a lot of people think that all these things happen way later in life, right? Okay, dementia shows up in your 80s or whatever. But those are metabolic disorders and diseases that really start way earlier, like this time period, if not even a little bit earlier. They're midlife diseases.
Well, first of all, out of all the nursing homes in this country, only 5% of people ever end up living in a nursing home. So we need to clear that up. I think that a lot of people think as they age, like that's the inevitable decay, decline, frailty. Those things are preventable. And so we actually have a lot more power than we think. But one of the things you mentioned was that people are afraid of Alzheimer's disease or a related dementia. It is the number one most feared disease, even though your chances of dying from heart disease, cancer, all the metabolic things, you're a lot more likely to die from that than from Alzheimer's disease. But there is a big stigma, and it is the most feared disease. And I think a lot of that is because if you get cancer, we can chop off that part of your body, which isn't dramatic at all. But we can't really chop off our brain. And a lot more research has been put into heart disease and cancer. It's only been since 2011 that we actually developed a national plan to deal with Alzheimer's disease. And you hear a lot of statistics, we have, 5.2 million caregivers in this country for, 6 million people living with this disease, but by 2030 it's going to more than double. But when you actually, and I actually have a PowerPoint slide where, I show which generations are included in that. But when you overlay that from those statistics from the Alzheimer's Association with the total population growth, the numbers remain, the percent of the population remains the same. I mean, it might go from like 11% to 14%. So I think that really matters. And what we think about aging really does matter and impact our quality of life, because if we have negative beliefs about aging, we can actually decrease our lifespan by 7.5 years. I don't
Oh,
know if
wow.
you've seen the recent Instagram reel with Jane Fonda and Ashton Applewhite, you know, talking about this, that what we think about and how we think about things. So I think the term stinking thinking
Yeah.
can actually be a part of it. And um, so just to kind of put that out there, that the fears might be a little disproportionate, and that there's a lot of things that we can do now to set ourselves up for less risk of developing Alzheimer's disease by controlling and preventing metabolic issues or addressing them earlier in life.
Yeah, I do. I like the idea, and well, actually, just the data that support, stinking thinking, because it does seem to be like, obviously my community, my listeners are very proactive about their health and want to age in a healthy way. But I would say there is a fair amount of the population, if not a very large percentage of the population, are kind of like, well, it is what it is. I'm getting old. It's just the way it's going to be. I have people in my life that are in my family or in my extended sort of friend group that are kind of like, it is what it is. And
And
so I
and
think,
that's called ageism.
yeah,
And if they were talking about that because of their race or their gender, everybody would be upset. But, we're allowed to have ageist beliefs. You look at birthday cards over the hill. So we really do need to think about it as a society about how we think about aging.
yeah, because I mean, look at Jane Fonda. I mean, my God. I mean, yes, she's obviously had some support. Let's just call it that. But oh my God, she is 2.5 years younger than my mother, like
Right.
quite literally. And it's like night and day, like, because she's always taken care of herself and she's always really, really worked hard to take care of herself and live a positive lifestyle.
Yeah. I mean, even, you look at J-Lo and you look at, I mean, there are a lot of actresses now. I saw Whoopi Goldberg on like a red carpet event recently, and she's like, look at all of the women here. And we are of all ages and all ethnicities. And, so I am seeing more positive images about aging in the mainstream media, um, or shows that at least are addressing it. I watched a Netflix show, Younger, recently,
Yeah.
where the girl, was facing age discrimination in the workplace. So she
Mhm.
pretended to be 26 when she's 40. You know, um, so it is something to think about. But again, there's still a lot that we can do, and taking care of yourself is really the most important thing that you can do, from your skin to what you eat, to exercise, to sleep. I mean, all the stuff that we all know to do, but just might be harder for some people.
Yeah. So if you were to give my listeners, like, again, like you said, it's the idea of dementia and Alzheimer's obviously is the most feared because you're afraid that you've lost your mind, but that you're still physically here. If you were to give my listeners, like, what are the three things? Like, if you're a 40, 50-year-old woman right now in that age range, what are the three things that you're like, these are non-negotiables? This must be a double down. I think I know what you're going to say, but I just would love to hear yours. Double down on these three things. What would you say it is?
So I think the biggest thing is is sleep, and then diet and then exercise, and not just cardiovascular exercise, but there's a lot of science coming out now about the role of strength training and how important that is. In fact, there was something recently that I saw that was flagged. I was like, we definitely need to consider, think about doing something about this. But estrogen, and you have to correct me on this part, but estrogen is in our muscles. Muscles
Yeah.
are attached to bone, and if you're not using your muscles, through strength training, it doesn't have to be. I don't think it needs to. You should not aspire to be like a bodybuilder. I think even with your movement, your physical activity, like you don't actually have to be running marathons and this is actually all science based from the blue zones. I don't know if you know about Dan Buettner's work. Um, but the number one principle of a blue zone is moving naturally. So
Yeah.
it kind of takes the stress off of when you look at these high areas of centenarians around the globe, there's only one in the United States, but if you watch that documentary, the other 4, they're farming, they're doing housework, they're walking to the market, and then you go to Loma Linda, California, and they're in a gym.
Yeah. Yeah, it's a very
So
modern concept of just physicality, to go to a gym, and it's
right.
because the rest of our world has become sedentary. I think one of the things that I thought was really interesting about the Blue Zone is they had some of their research and they were looking at the longevity numbers were completely correlated with the pitch of the mountains in the city you or town you were in. So basically, the moms and dads that were carrying crap up and down the hills
Mhm.
actually lived longer. So the higher the hills, the more steep the incline, the more likely you were to live longer. So the reality is it's we need to move more and we need to move try and mimic those same sort of things that our ancestors did. It wasn't running 26 miles. They would look at us like we were crazy. Like, what are you doing? What are you running
Yeah,
from?
right. There was one person chosen to do that for the whole village.
Right, and
The
they
rest
were
of us don't need to do it.
yeah, and they ran to the other village way back when to tell them something. It's like,
But
we
I mean, but it does speak to, if you can take the stairs instead of the elevator. I mean, we've built in a lot of conveniences into our society that you have, there's always for every decision, there's a consequence. But
Mhm.
yeah, so it was like if you can take the stairs, because I mean, I live in Wilmington, North Carolina, where it's pretty flat. But there are certain streets that I know have a steeper incline coming, from the Cape Fear River up. And I also chose to live downtown for the walkability of it, because otherwise you have to get in your car. If you live in the suburbs, you have to get in your car to go anywhere. So just making sure you get your 10,000 steps. And if you can build in stairs or a steeper incline, that's really the best thing that you can do. And then trying to figure out some way to get some sort of strength training, especially like upper body and your quads. Um, that's like the most important thing. And strength and flexibility, because if you have better balance, then your risk of falling is less. And so yeah, another thing is to sit on the floor. Practice getting up from the floor.
Mhm.
There's a lot of muscles that we don't use anymore, that a lot of other cultures do. Um, and then, making sure with your diet that you're getting protein, eating as clean as you can, avoiding processed foods. So basically anything that comes in its own wrapper, like oranges,
Yeah.
fruits,
No label.
vegetables. Yeah, don't need a label. Um, and then drinking water, obviously, are all the things you would need to be doing with your diet. But I think the biggest thing for me was I always thought that I got enough sleep. And I
Mhm.
pretty much felt like for the most part, I got good quality sleep. But I got an Aura Ring about a year ago, and I was like, "Oh my goodness, I'm not getting 8 hours of sleep because I'm only in the bed for 8 hours."
Yeah, exactly. It's like, "Oh, wait a minute, that's not exactly right."
Yeah, it's like if I lay down at 10, I get up at 6, I'm like, "Yeah, I got 8 hours." It's like, "No, you're just in the bed for 8 hours." So I think that in that way, like some of the biometric, wearable technologies can give you insights into actually, what your sleep quality is like, how much sleep are you actually getting. Um, and so I would say to use technology as much as you can for that too. I wear an Apple Watch so I can track my steps.
Yeah.
Got my Aura ring on for sleep.
Oh, I
Soon
know.
somebody will create something that'll take pictures of whatever I eat.
I was actually involved in a startup company years ago that was trying to perfect. Now, AI is probably going to have a much better capacity to do that today than what it was then, but they were trying to quantify and be able to do that because I was like, that's what I want. I want somebody to be able to take a picture of a plate and go, okay, tell me the plate size, and then I can tell you the distribution of the food on it. Because that way you could actually pay attention because nobody wants to track their food, you know,
Yeah. And that'll
consistently.
work for a little while because as human beings, we do have free will. Because even when they first put the calories on menus for you, like at first you would pay attention, and then at a certain point, you're just like, yeah,
Yeah.
I just want that today.
Exactly, we qualify that. We definitely qualify that. So, so I wanna go back and, so we're talking about dementia, we're talking about, all the things that they can do, and I think, like, I wanna kinda state why sleep is so important because as a nutrition professional, and a biochemistry sort of, immersed in that world, I looked for every possible way to avoid having to hit that target. Because I was somebody that was like, "I'll sleep when I'm dead. I don't need it, la, 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 la," and I never really slept well. I'll be really honest. Since I was a kid, I was the kid up in the middle of the night with a flashlight reading a book. And it wasn't until I really hit perimenopause that it really came to a head. And I ended up going through airway, um, an AGA device to change the palate of my mouth to improve airway. But I think what's so important for people to understand is that's the time for memories to get stored and for us to process emotions. But it's also when the brain kind of opens up the spigot of the sewer line in the brain to exit all that crap out of the brain. And quite
Yep,
literally, it can't do the cleanup process,
exactly.
you know?
Yes, you explained it very well.
Yeah, I mean, it's like that I think needs to hit home. It's not just restorative and all this other stuff. Like your sewer system is backing up. So it's like the trash people didn't pick up in New York City for 2 weeks, you
Yeah.
know, you know, and that's just huge. That's just huge. Okay, so so everybody on the podcast so far, these are the big things if you're worried about this because it is a true worry, right? Statistically, women are going to have a much greiter risk and we know
But part of it but
yeah,
let's
go.
talk about part of why that I mean, part of that is women tend to live longer.
Mhm.
And, Alzheimer's disease is one of the greatest risk factors is age, although we are starting to see a lot more early onset. So there with Alzheimer's disease, there's early onset and then there's like the later onset. Um, and then you have the other types of dementia, but the biggest risk factor is age. So if you live long enough, there's a chance that you will have some form of a cognitive impairment, but it doesn't mean that you go from being normal today to like even the next year being like completely incapacitated.
Right.
And 95% of people living with Alzheimer's disease are cared for at home. And the problem is we just don't know who's going to progress and who's going to kind of stay at like a mild,
Yeah.
to moderate range.
Yeah, and then I think there's a lot of, misinformation and or lack of information about vascular dementia and the risk for that because so many women have heart disease risk or hypertension, all these other conditions, and including men. But if we make it through those, like if we don't have the heart attack or we don't have the stroke or whatever, there's often vascular consequences that start to affect our memory too,
Right.
and we overlook it.
Well, and vascular dementia is a type. So
Mhm.
dementia is a broad umbrella term.
Yeah.
And then you have the different types. And Alzheimer's disease accounts for about 60 to 80% of cases. So that's what most people are familiar with. But then, vascular dementia is a tight second
Mhm.
because of that. And so when we think about, going back to preventing it, I think that really understanding the role that inflammation plays in our bodies and making sure that we're eating a low and an anti-inflammatory diet, which is all the stuff that we just talked about, natural foods, clean foods. Those are the things that you can do to reduce that inflammation, to reduce the vascular risk, and hopefully you won't end up with a mixed version of that too, because that happens too.
Yeah, totally, totally. Okay, so now I want to talk about what is probably true for most women is that we end up, and like you said, I didn't realize the stats were that low as far as assisted living memory care units, nursing homes, whatever you want to call it. I knew that the vast majority of people who were impaired in some reason or for some reason were actually cared for at home. But the reality is most women, at least in this age group, are going to care for an ailing parent, if not multiple, on top of their own children, on top of their job, on top of their own health, their menopause, and everything else. And I know clinically, sitting in the room with people, and especially my clinicians in my clinic and on the telemedicine, this is like every single woman's like, okay, I'm also caring for somebody. Like, this is huge.
Mhm.
Yeah, this is
It
huge.
is, and one of the things when you're dealing with your kids, you kinda have a cohort of people that you meet that are going through the same thing, and there's a lot of, think, education around, when your kid turns 5, they go to school, or you or they start with a pediatrician who kind of says, "Here are the things coming up that this next year you need to be thinking about," because you have developmental milestones that all kids go through. The problem with aging is that it's a crapshoot. There's not I think people think that when I get old, this is what's going to happen in these steps. And it's like, no, because all of your life choices make a difference. So if you grew up in your 20s and 30s and 40s and you've smoked and you've drank, you've not exercised and you've eaten crap, you're going to have a very different health span trajectory than the person who didn't do those things, who drank, water and watched their diet and was physically active. And I don't even mean like perfect, just the contrast of those two lifestyles really plays out as you age. But there's not like I mean, when you turn 65, you get a welcome to Medicare visit, but it's not like they say, here are all the things that are going to happen to you. Um, I heard a joke the other day. It was a guy was talking about, imagine turning 50 and you're going to be going to college for aging. And
Mhm.
so you could be like, oh, well, I've got to take financial caregiving and Alzheimer's disease, like these are my courses for the semester. And then you have the other person who's like, oh, I'm going to take pottery and yoga and in international travel. And it's like, man, how did you get such a light course load? It's like, you don't know what you're going to get. And there's not really a guide to help you. And it becomes more complex because it's so different. But I would say to any woman who's a caregiver or finds themselves in that sandwich generation, to look for the resources in your community that are there to help you to help lower your stress, because that's really kind of the heart of your question is,
Yeah.
how do we take care of her when she's sandwiched? She called this sandwich generation for a reason.
Yeah, exactly. I mean, as somebody who's living through it, and I know plenty of women who will say, my parents never planned for anything, never really talked about it. My parents were on the opposite side of that. Like, I could have pretty much clocked it like once a week. They were going to be like, here's where our will is, and here's where this is. And even though they had sort of thought through, I guess, what they think of their financial planning is, it's the caregiving and decision making about medical decisions. It's the attending hospital visits and doctor's visits. And, how do you make your home if they happen to be at home? My mom is not in my home because she's a full assist. So we needed 24-hour care. But how do you make your house safe
Mhm.
and effective for your ailing parent, because that is a reality, because most women, they're taking care of them in their own home, or trying to manage between multiple homes. So what would you say to the woman that might be listening? They're like, oh my gosh, I think I'm headed down that route. What would be the first, like, couple things you think through, like, here's your next steps of what you need to do in this world? Ladies, if you're noticing more fine lines and wrinkles, it's not just about aging, it's about the loss of estrogen. And that affects our skin structure, making it drier, thinner, less firm. But here's the great news: I've created Bias Mastery Cream to help. This luxurious bioidentical estrogen cream supports your natural hydration and elasticity. It's packed with nourishing oils like olive, jojoba, aloe, and coconut, so it feels amazing and helps soften those lines and bring back that healthy glow. I've been using it, and let me tell you, my skin has never looked or felt better. It's smoother, more radiant, and those little cracks and creases are way less noticeable. If you're ready to give your skin some extra love, check out Biased Mastery on the Metabolic Blueprint website. And that's metabolicblueprint.com/biased mastery. That's BIEST mastery, MASTERY. And your face will thank you.
Well, you mentioned having a safe home. I know I've done a podcast episode on how to create a dementia-friendly home, which is pretty much the same as an age-friendly home, so thinking through your lighting, making sure your physical environment is safe. Um, but even before that, I would say probably the biggest key to being a caregiver is trying to stay in the present moment and do not let your thoughts and anxieties go to the future with the worry and the dread and the what ifs and all the bunny trails, because half of that stuff isn't going to happen. Just like in our regular, I remember a in my 20s, the guy I was dating who ended up being my first husband, he goes, "You worry about so much stuff and half of it isn't going to happen." He goes, "Why do you do that to yourself?" And I was like, "I don't know. Like, there's an option not to." you know, but it's because there is so many other things. But like you said, I would know where all the important paperwork is. Do your parents have a trust or a will, a healthcare power of attorney, all the important financial paperwork, making sure they've written down like all their account numbers and the passwords to those account and that you're looking at those at least annually. Um, because there's stuff that you may not even realize. And especially if you think they're starting to develop a memory problem, that you know where all the financial stuff is. But then beyond that, it's gonna be day like a everything's good till it's not, right? So I think learning as much as you can about what is the difference between assisted living and a skilled nursing home. Um, who qualifies to go to both? How are they all paid for? Because I think people still don't understand long-term care.
Mhm.
What is an area agency on aging? What do they do? Give them a call, look at the resources that they have. Maybe you need Meals on Wheels to help with your parents. So I think it's just becoming more familiar with the resources that are already there and forming you know, connecting to groups of people that are kind of going through the same thing that you are. Um, but I mean, I think about it myself. My grandmother is 90 and she got sick and my parents called me last week and they're like, "Can you go with us to the doctor?"
Yeah.
But as they're telling me, I was like, "It just sounds like a bladder infection." But my dad was really worried,
Mhm.
and so I went and it was a bladder infection, but it was pretty much a kidney infection before it was all over. So she did go to the hospital, but she's back home now and she's fine. So, um,
I mean,
I don't know. I
it's
mean, I think
super common.
it is. But just knowing where the important paperwork is, trying to stay in the present moment, but at the same time, trying to think about things that you haven't thought about before
Mhm.
regarding housing and transportation. And there are a lot of resources and communities that I just think people aren't aware of, which is actually why I started my podcast, was to make people aware of some of the different resources because it's not the same everywhere. I think
Yeah.
that's another thing. We think that our communities are all the same and, you know, the resources are the resources. It's like, no, they're vastly different. Like in Northern Virginia, they had this whole program called NV Rides. It's a volunteer program and it's door through door. Like you can call Uber or Lyft, that's door to door.
Mhm.
But the door through door, a volunteer will pick you up, take you to your appointment, go in with you, make sure you get to your appointment and back, and it's 100% volunteer. That doesn't exist in Wilmington, North Carolina.
It doesn't I've never heard of it in Dallas, I'll tell you that.
Right. But so part of the reason for the work that I'm doing is to just tell people about solutions because a lot of times if you have a problem, you don't know what to do, you don't do anything. But if you've heard of a solution, then you might be able to find people in your community to help bring that solution to your community as well.
Yeah, so I'd love for you to explain because, like I said, I was immersed in this, and I think the other thing is people think that the progression of your loved one on decline is something that is going to be this kind of slow progression. And like in my mom's case, she was checking her taxes. She painted a neighbor's fence. She's 89 years old. I didn't know she did that until after she did it. But she literally went from that to 100% full assist stroke and, stroke induced dementia in 24 hours. So
Mhm.
you're always thinking, well, I'll be able to do this next step, or I'll be able to figure that out. Cause my mom was showing no signs of decline. Right. And I knew that. I'm in healthcare. I knew that, but you're always like, oh, I can deal with that like next week, and you keep kicking football. But I'd love for you to talk about, cause I think this is really important. I didn't know the difference between skilled nursing and nursing home and assisted living and memory care. I thought I understood it, but it was actually way more nuanced than that. And I think it's important because they have really different rules too.
Yes, they do, and different payment structures.
And they will boot your butt out of one, and they won't tell you until like 24 hours beforehand. They're like, "Shoot, you got to go get her." I'm like, what?
Yeah.
So
And they should, that depends on where you're at.
yeah.
But typically what will happen, like in your scenario, your mom probably had a stroke, goes to the ER.
Hmm.
You have to have a three-night stay in the hospital to evoke your Medicare Part A benefits. That's your hospital insurance. Now, part of Medicare Part A also covers up to 120 days of skilled nursing care. When you hear the term skilled nursing care, and a lot of them have changed their names because of ageism and fear and stigma, that like don't nobody wants to go to the nursing home, so they're called rehabilitation units. They're still a skilled nursing home. What that means is right now that at least one registered nurse is on duty for 8 hours a day. That's even if it's a 300-bed facility. They're only legally required to have one RN. Now, there is legislation in Congress right now to change that to one registered nurse 24 hours a day. A lot of brouhaha about that. I personally think that every nursing home should have an RN.
Hmm. I agree.
But you have RN, it's nursing care. Skilled means a licensed nurse has to provide it. Then you also have like rest home levels, which is different. There's not necessarily going to be skilled people there, skilled nurses there.
Mhm.
And then an and that is the skilled nursing home is all governed mostly by the federal government. There are federal regulations that were put in place in 1986, which I couldn't believe it took them that long.
Yeah.
But it's the most heavily regulated industry next to nuclear power plants, skilled nursing homes. It's crazy. Then you pivot and you have assisted living facilities. And you have memory care units in here. They can be in a skilled nursing home, which would be regulated as a skilled nursing home is, or it can be in a memory care unit in an assisted living facility. So if it's an assisted living facility, those are private pay. Because what happens if once your Medicare Part A days are up, then you have to spend your personal assets if you still require skilled nursing. If you don't, then you have the choice. If you qualify, you could transition to an assisted living facility. And then, but if you need memory care, then you have to find one of those as well. But then you start to spend your own money unless you have a long-term care insurance, which is there's a huge thing going on with that right now. The long-term care insurance policies are going to become a thing of the past.
Yeah.
And there's some caps that go with that I was just like, are you kidding? Somebody could pay, $400,000 in premiums their whole life, and you're capped at 300,000.
Yeah.
Seriously?
Like, let's just save the money at that point. Like, why buy the insurance? Yeah. Well, it's because people are living longer, and that basically they can't support the insurance policy anymore. You
Right.
know.
And so the insurance companies have figured out how to cap it. So be sure you read the policies. But anyways, so then from the, but if you qualify to be in assisted living, it's just like that, the nail salon show where she goes, "Oh, you want long nail, short nail?
Yeah.
Only $20 more."
Yeah.
So with assisted living, depending on what level of care you're at, they can certainly take care of you for $2,000 more a month. And it's actually cheaper to live on a cruise ship for a year than it is to live in an assisted living facility.
Yeah.
So if you're able, just go live on a cruise ship. They will do your laundry, they'll clean your room. You've got medical care right there, and you're traveling. But yes, so there's and to go check out some of the places and get an idea of how much they're going to cost,
Hmm.
because it's better to have some general idea of what they're like and what to expect. And I have a checklist that people can get to go around to the facilities just so that you know what they look like, because otherwise you're going to have to make this decision in a crisis.
Yeah, in a
It's
matter of days, if not hours, honestly.
Yeah, and if you don't have a friend in geriatrics that's been in those facilities, like, it's not like you have somebody that you can call, and there are some ways you can go online and try to figure out, what cares is best, but an on-site visit really is gonna be the best thing to do, and then just understanding the payment c for each of them.
Yeah, I think, one of the things, I mean, I knew because my mom, thankfully, we had bought a long-term care policy way back in the day when it made sense and it was actually financially viable to buy one. And we had gone to several facilities. So I knew that as soon as she moved out of skilled nursing, that was basically on, basically the family's dime, whoever's going to pay for it. Um, but what I was very surprised by, my mom was like always kind of prepping for this idea in her head to some degree, and she'd want to go look at these different places. And it didn't matter how nice it was. Like you go to the ones that are beautiful on the outside, like everything looks fancy. They talk about all the fancy food and stuff like that. But all of them only go so far, at least in my experience, to follow federal regulations. So it's not like they're going to knock it out of the park and add 5 more nurses to the floor. Right. So
Well,
the care may or may not change depending on what level of service they have, like you said, if you're going memory care and all that other stuff. But I didn't see anybody that was doing like way above and beyond.
right, well, so assisted living is governed by the state. They're regulated by
Okay.
the state, so
Every
every
state.
state is different.
Okay.
So that's the other piece of it, is, like, all 15,000, skilled facilities in the US are federal dollars. They get some money from the state. But assisted living, there's some state regulations, but they're vastly different than the federal regulations. And so you could be in North Carolina and assisted livings function in one way, and you go to Arizona and they're going to be different. So then you have to look at the state regulations, and they're not required to have a registered nurse.
Mm-mm.
And so basically you're dealing with probably med techs or nursing assistants. So this term nursing care is used very loosely, which aggravates me to no end
Mhm.
because it is misleading to the public. And so to be an educated consumer um, is really important, and to know the difference. I mean, nursing is confusing enough as it is. There's associate degree nurses, baccalaureate nurses.
Yeah.
So it's a lot, but it's good to have a general idea about all of these things. And
Yeah.
so if you went to visit a few, did she end up in any of those facilities?
Yeah, yeah, actually, so obviously she was in skilled nursing and, and again, sometimes you think that you're gonna be told a lot of things as the power of attorney and, they're overwhelmed and you don't always you don't have my basic statement here is you don't have time to go figure everything out. Those they have certain quality steps that they have to hit to stay in skilled nursing. Like if they're not showing progression, they'll Medicare will boot you out. And so we had been to several of them. And for me, it was very interesting because, again, the price difference was all over the place. But what they actually provided medically wasn't vastly different. Like you were paying for a lot of the design and decor and all that other stuff. But when it came down to who's on the floor, who's actually managing the floor, who's taking care of your loved one, they were obviously following the state of Texas. So it wasn't like, you pay this much more and you're getting that much better care when it came to the medical care. That's the thing that I was surprised by. She is in an assisted living center in Texas. We actually have companies that can do them in small homes. So she's in a small home with 7 people, right? So the volume is different. So there's a little more attention just because you're not dealing with, the hundreds of people in a facility.
Yeah. Is it like a greenhouse model? Because that's another model where there are a lot of the smaller um, kind of settings where you kind of walk in, it's a living room and a kitchen,
Yep.
the bedrooms are around the side, and you don't really see like a nurse's station, which
Yeah,
is
they have like a little nurses station, but it is very house-like. Yeah, so it has this sort of house feel, and so we were lucky enough to find one of those in our neighborhood, and so we've been happy with that. But again, you got to each one of those is different. It matters who manages them and what it's like. But I think I also recognize that I happen to have a experience of privilege that I'm able to do that, right? And a lot of women aren't. Like all of a sudden it's like you get to stay home and you get to watch after the family member that's ailing or trying to figure out how to pay for it. And I think that I think that's where it's just overwhelming for women.
Yeah. Or, like my grandmother, my mom's mom, um, she never I mean, she had a 4th grade education. She didn't really I mean, she worked some throughout her life, but, was basically incredibly poor, and was Medicare, Medicaid.
Mhm.
And when you're in that situation, when you're dually certified, your choices are even more limited about what you can do. And luckily they live, kind of in rural North Carolina, close by here. And so we are able to find, but again, tell, students, I tell them all the time, it's like you're not really saving for retirement. You're actually saving for your long-term care. And if you want choices, then you're going to have money to do
Mm.
that. And so you're right, it is a privilege to have the choice. Um, but again, um, it does make a difference.
Yeah, it does. It does. And so, if my listeners are, on here and they're kind of like, okay, I'm either already caring for somebody or in many cases they might care for multiple, at that
Mhm.
time, obviously there's the, figure out where everything is, the power of attorney, the will and other stuff. What would you say is the best way for somebody to handle the stress of that? It's
So the
very
very next
isolating.
thing, yep, and so that's what I was gonna the very next thing is to build a care team, because this is not something that you can do by yourself. And so beginning to look, and who is your trusted group of people. And when you need help with something, you know, people, will say, if you ever need anything, let me know. So those people just make a mental note and, have about 20 people on this list that can help you do things. And then you're going to have to learn how to ask and you're going to have to learn how to receive. So if you need somebody to come over for 2 hours so that you can go get a massage or that you can go to the grocery store or that you can take your car in, that you have this list of people and you can call them up and say, could you come over and hang out with my mom or my dad on next Tuesday from 10 to 12 so I can go get the oil changed in my car, you know, that specific. People will say, yeah, but people, I mean, if they can't do it that day, then you've got somebody else that you can go to, but do not try to do this alone. Um, yeah, you just can't. It's just like you didn't raise your kids by yourself either. So I'm not sure why it is that we think that we can be a family caregiver by ourselves, except that when you see people doing, caring for kids and it's common to go over for play days, we need to create that same culture
Mhm.
for an aging, America. It takes a village to raise a child. It takes a village to take care of an older adult. And the quicker you have that mentality and build your care team, the saner you're going to be, because a lot of caregivers end up dying before the person they're taking care of because of all the stress. So
Oh,
do not
wow.
put yourself in that boat.
Oh, yeah, that would be terrible.
Well, oh, I don't know if you heard about Gene Hackman's. I just saw this on
Yes, actually,
today.
let's talk about that because some people may not have seen that. Like that, what an extraordinary tragedy.
Yeah. Well, he was older, frail, had
Mhm.
Alzheimer's disease, and then his wife dies, and he's in the house for a week by himself.
Yeah.
And they're isolated. They have become more and more secluded. So they didn't have people coming by to check on them. And so our social connections are probably the most important thing that we can develop. And I
Yeah.
know moving back here to Wilmington, I was like, I'm going to build my girlfriend tribe,
Yeah.
you know, build my friend group up because I mean, and it takes effort to be a friend and to make friends. So,
Mhm.
but that's why it took so long. I think it was like a maintenance guy that finally found them.
Yeah.
And, and she had some rare,
Like
like
hantavirus. She died of hantavirus because she was young. She was like 63 or something like that.
30 years younger than him.
Yeah. And so she passed away. So for anybody that hadn't really read the story, they were both found in their house along with a dog that was trapped in a kennel and had been dead for quite a while. And so she had this virus, passed away from the virus from a respiratory problem at 63, which I think is incredibly young. Um, and he was, altered enough that he probably really didn't recognize there was anything wrong with her. He thought she was sleeping because he had pretty significant dementia in his 90s. And then they found him like in the mudroom. that he just passed
Yeah.
away basically from natural causes. But he'd been walking like around doing stuff around the house for a week, and she was dead in the bedroom and he didn't know.
Right. And that's I mean, so that's what I'm saying, like, that's a classic situation where you have a caregiver for someone living with Alzheimer's. They've socially isolated themselves for probably a lot of different reasons,
Mhm.
and, something goes down with the caregiver, and there've been other incidents like that on the news, so I've always said, if you know somebody in your neighborhood, at least keep a check on them, and to make sure that you have family and friends that are checking on you
Mhm.
too.
Yeah, I mean, we definitely between myself, my husband, and one of my mom's best friends who was actually like in her 70s, one of us would talk to her pretty much every day. And so it was always like, what's going on, just as a way to check up on her. We may not have physically seen her every day, but we're already, always talking to her and checking on her. Because, yeah, you don't know what you don't know.
Right. And that's also important too because it's almost important to have both kinds of people. People that see the person all the time,
Hmm.
and then the sibling that comes in every 6 months. Because the sibling that comes in every 6 months is like, "Whoa, this is different from last time I was here." And because sometimes the changes can be so slow and insidious that you don't pick up on it, and you're like, "Oh, that's right, like 6 months ago, she was doing this and doing that," you know? And so, I think it's good to have both types of people. But again, just making sure you're not trying to do it alone, making sure that you're looking for the resources in your area. If you're having, you know, a, a struggle or something that you're trying to figure out, to pick up the phone and call somebody. Um,
Hmm.
Elder Care Locator is one place to find your AAA, your area agency on aging, and just get connected and keep talking to people because there are answers out there. But I think a lot of times people get frustrated and they're like, there isn't anything.
Right.
Nobody cares about these people, and it's like, a lot of people care about them. We just nobody wants to think about us until they need us.
Right. Yeah, that's true. That's true. Yeah, we kind of. I don't want. No one wants to acknowledge we're getting older or that our parents are getting older, but I do think the reality is it's a huge stressor for women in this time period of life and onward. And the more we prepare ourselves for what could potentially happen, not only for ourselves, I mean, this is just as important for us to plan. So if we have children, I happen to be children free, but if we have people, you need to prepare yourself so you're better prepared, so your family members are better prepared, because we're not just going to probably, just die. You're going to have some decline. Like that's the
Right.
stats.
Well, even if you do just die, somebody's got to deal with your
Stuff.
stuff.
Right.
Yeah. So I mean, that's something to figure out too, like,
Mhm.
who's gonna deal with my stuff, I've been trying to get rid of stuff. I'm just like
Oh, we just cleared out my mom's house, like, just finally, because my mom had her event in April of 2023, and I, like, sealed up the house, and we go over there all the time, and I had somebody doing the lawn and, like, everything, because I just couldn't handle it, because my mom was kind of an organized hoarder. She was your typical woman from the Depression. She kept everything in case you could use it, and I'd go in there, and I'd be like, "Oh, I just I can't do it," and I would close the door, and I'd be like, "Okay, now I gotta deal with it." But like that, and my husband and I came home immediately and we're like, all right, time to get rid of stuff. Like, let's go ahead and just jettison some things that we don't need.
yeah,
Because, my mom was always like, we don't want to be a burden. And here's our notebook. And I'm like, yeah, your house was a huge burden. It really, really was. It's
yeah,
enormous.
yeah. So, yeah, I had a storage unit, and I'm like, hadn't been over there in a year and a half. I'm like, "I don't think I need anything in the storage unit." So I had my son come down, and buddy, we took care of that storage unit in a day, and I was like, "So why was it all sitting over there?" You know? But then it was in my apartment for a little bit, and now I've got it kinda sorted out, but yeah, I mean, it's thinking about things like that. My parents are in their early 70s, and they're just moving into a new house, like, they're building and moving,
Hmm.
you know? But it's interesting how the conversation changes too, because they used to build and sell every 2 years when I was growing up. He was a home builder, she was a decorator,
Okay.
and so they're like, "This is the house we're gonna die in." I'm like, "Why do you have to say it like that? Maybe just say it's the last house you're gonna build," and
Yeah.
we all kinda know that it's likely, but you don't have to, like, put it out there.
Yeah. Yeah, exactly. You don't have to put it out there, but you know, it's likely their last house. They're not going to go through this process again.
Oh, they're definitely not going to build again because they've already said that. I can handle that part of it.
Yeah. Yeah. Yeah, but I think it's so important, and I think, a lot of times we wanna just stick our head in the sand and not imagine our own aging or our aging parents, but I think as women, we have to just understand that that's going to fall on us. It's the unpaid labor. It's one of the big unpaid labors of our lifetime.
It is. It's actually more than well, it's like more than the profits of like Walmart and McDonald's and like one other major company put together. That's how much unpaid care is being delivered, and so like over $1 trillion. So I would also say, no matter how old you are listening to this, it's not too late to start to make sure that you're walking and that you're moving and you're doing your strength training and you're taking care of yourself, because you can't take care of anybody else if you're not taking care of yourself. Rule number one in nursing school:
Yeah.
take care of yourself so you can take care of others.
Yeah. Because as our parents age, we age. So that means whatever thing that potentially puts them into a need care environment means you're also older at the same time. It's not a 20-year-old doing this. It's not.
Yeah. So my mom brought my grandmother home before she passed away, the one that was in the skilled nursing home. My grandmother gotten so frail there from COVID that she couldn't even stand to like pivot.
Mhm.
And yes, so my mom called me and I was like, okay, so my 92-year-old grandmother, I'm going to help my 72-year-old mother. But I got there, I was like, I'm 52. Like, you know, we are none of us are spring chickens here,
Yeah.
So it's amazing how quickly we all get there.
Yeah, absolutely true. Absolutely true. So, no, you've got a checklist, I believe. It's the podcast insider's guide. Tell us about that. Tell us first, especially about your podcast and where they can find it, and then the guide that you have too.
Okay. So the podcast is called This Is Getting Old, Moving Towards an Age-Friendly World. And while I talk about aging, ageism, age-friendly initiatives, Alzheimer's disease, it's largely also about all the stuff that's not in place for an aging society, because that's what's really getting old. That we've known that the boomers were going to be getting older. We're not ready for them. They're not even the largest generation anymore. The millennials are. And they just started turning 40. So they're old enough to sue for age discrimination in the workplace. We got less than 25 years to get ready for the millennials. So we'll see if we get anything together. But my website is melissabphd.com. And when you go there, that's where all the social media links, the different places to find the podcast are. And the podcast insider guide is really just like a jump start. It gives you the 10 warning signs of Alzheimer's disease, but then also 10 things you can do to age your best. So a lot of what we talked about here today. And then it just connects you with my community, so that, as new episodes come out, I can let you know about those. And we talk about a lot of different things. But we did frauds, scams, and financial exploitation past couple of weeks. So it
That's
just
huge.
depends on who the guest is. Had several people from assisted living, skilled nursing home. So almost everything we've talked about today is like a whole episode.
No, that's great. Like I said, it's not something anybody wants to really dive into. We like to just sort of stick our head in the sand, but it is something that you need to really be aware of and actually know the ins and outs before you need it.
Right. And if you think, oh, there's geriatricians, they'll help me. Well, we have over 6.2 million nurses and doctors in this country, and less than 1% of us are board certified in geriatrics. So,
Yeah. And it's very, very different caring for geriatric patients compared to caring for a middle-aged patient. I mean, I know I ran into that with my mom's care providers. I was like, you need to see somebody who's actually certified as a geriatric provider,
yeah.
because they were pushing for things that just didn't fit. I'm like, no, that's not right. You know.
Yeah.
So, yeah,
So
it's very
they're
different.
then lucky that they had you there to advocate. So,
Yeah. Yeah. So, no, it's so true. Well, Melissa, it has been wonderful having you on Menopause Mastery. Thank you so much. Thank you so,
yep.
so
And
much.
in a couple of weeks, you'll be online. So
Yeah.
if they get the podcast Insider Guide, they'll be alerted when your episode comes out.
Awesome. Awesome. Well, thank you so much for being on. And for everybody listening to Menopause Mastery, thank you so much. And if you found this to be valuable, please share it with a friend.